Hi friends, thanks for dropping in. This is Aigner. Hopefully you can benefit from some of the information I'm going to share. Welcome to my podcast. As we welcome the year 2020, the second decade of the 21st century, I don't think any of us would have imagined things would develop the way they have. However, as you all know, 2020 is off to a memorable start. We're only in the third month of the year, and things seem to be going rapidly downhill. Let me briefly recap a few things that have happened thus far, and then we'll go into the subject matter of this podcast, COVID-19. So to start off, the U.S. ordered airstrikes in Baghdad, killed top Iranian General Qasem Soleimani. Iran, in retaliation, fired missiles against U.S. forces in Iraq, and in a separate instance, mistakenly shot down a Ukrainian jet which crashed shortly after takeoff in Tehran, killing all 170 people on board. In Australia, devastating wildfires raged. The UK officially exited the European Union, and Prince Harry and Meghan Markle decided they had had enough of the BS and announced they were stepping away from the royal family and would be living between North America and Europe, Canada to be specific, and then later LA. In the South Philippines, the Taal volcano erupted, grounding hundreds of flights and resulting in 39 deaths. Then the world was devastated when NBA legend Kobe Bryant, his 13-year-old daughter Gianna, and 7 other people died in a helicopter crash in Calabasas, California. And we started hearing about a novel coronavirus outbreak. But because it was so far away in China, I don't think anyone was overly concerned. But on Friday, January 31st, the World Health Organization declared the spread of the virus as a global emergency. In addition, we started hearing about a cruise ship carrying infected passengers that was stranded off the coast of California. I think that there were about 3,500 people on board. And of course, people thought that the media was sensationalizing everything. Everyone should just go about their business and blah, blah, blah. But I had been following closely the coverage and I grew concerned. I really started paying attention in early February when the U.S. began to evacuate hundreds of Americans from Wuhan, the epicenter of the virus, and they were going to be quarantined at military bases for 14 days, they said. In my opinion, in retrospect, that evacuation was improperly handled. People who were already infected were on the same flight with those who were not, and several passengers didn't even know if they were actually infected, as not all of them had received their test results prior to boarding the flight. Many, by the way, turned out to be positive, and it was later learned that proper screening was not administered upon their arrival in the U.S. The Diamond Princess cruise ship was stranded off the coast of California. They had over 3,000 passengers on board, and many of those passengers were showing symptoms of the virus. They would later be allowed to disembark and would be quarantined at Travis Air Force Base in Solano County, California. The nightmare had really begun. The virus was now in the U.S. Contained or not, it was here. But for now, let's talk about the coronavirus, since it's literally consuming our lives and wreaking havoc at the same time. It is, after all, what this podcast is about. What is coronavirus COVID-19? The 2019 novel coronavirus, or 2019-N COVID-19, is a new respiratory virus first identified in Wuhan, Hubei province, China on December 31st, 2019. It is now in more than 100 locations internationally, including in the United States. Now, coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people, such as with MERS, SARS, and now with this new virus, COVID-2. It's a beta coronavirus with its origin in bats. And early on, many of the patients at the epicenter of the outbreak in Wuhan, China, had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, though, a growing number of patients reportedly did not have exposure to animal markets, indicating person two-person spread, which was of grave concern. January 30, 2020, WHO declared the outbreak a public health emergency. On January 31st, the next day, Health and Human Services Secretary Alex M. Azar II declared a public health emergency for the United States to aid the nation's healthcare community in responding to the infection, which by that time had been named COVID-19. On March 11th, jumping forward, WHO characterized COVID-19 as a pandemic. And on March 13th, the President of the United States declared the COVID-19 outbreak a national emergency. I'll repeat, a national emergency. And to that end, he imposed a travel ban from Europe, with the exception of the United Kingdom. However, within 24 hours, the UK was included. For 30 days, no one was going to be allowed to fly to the United States from Europe. Italy has been heavily affected. France, Britain, it's spreading globally. In California, patients at a nursing home with no known person-to-person contact started getting sick with the virus and died, going from showing symptoms, then passing away, to just passing away asymptomatic. Now, the interesting thing is this nursing home was about 23 miles from Travis Air Force Base in Solano County, and that is where the evacuees from the Diamond cruise ship were being held. Was this virus then now airborne? And how did two college students at a nearby university, also with no foreign travel and no known contact with the virus, how did they contract it? This was very worrying. It brought to mind that the virus might be community spreading. And this means that people have been infected not knowing how or where they became exposed to the virus. Frequent hand washing for 20 to 30 seconds. The use of hand sanitizer, covering your mouth when you cough, and sneezing into a tissue and then immediately discarding it into the trash. You should stay away from people who are sick and frequently clean surfaces. Limit attending large gatherings, and in many places, gatherings over 500 people have been prohibited, and many schools and organizations and churches and establishments are experiencing closures. Now, in case you're wondering or still have any doubt about how people are affected, the virus has a unique way of affecting different age groups. People with chronic medical conditions over the age of 60 will need medical attention. People with chronic medical conditions over the age of 80 are most likely to die, and this is according to the U.S. Surgeon General. And children and young adults have been found to have a lower mortality than if they got the flu. So how do you prepare? It's most important to understand that preparing does not mean panicking. The Surgeon General said, 1, you should know your risk, which means know if you fit into one of the high-risk categories, over 60, chronic diseases, or 2, understanding your circumstances. Are you planning to go to a basketball game? Is it important for you to attend? Are you planning to go to church? Are you planning a vacation? Then you have to look at your risk and put in perspective how important that is in relation to the circumstances that you're going to be involved in. He also suggested that you know and understand how to protect yourself. We cannot emphasize enough that the best way is to wash your hands for 20 to 30 seconds, and you use at least 15 seconds to lather up the soap and water on your hands. Wash the top of the other one, and just get a good lather for 20 to 30 seconds and then rinse. And if you're like me, you'll probably do it twice, which is fine. Now, as things stands, let's just recap how things are at the moment. Large festivals, beginning with South by Southwest, started canceling, and it rapidly became a ripple effect. One NBA player from the Utah Jazz became infected, and the entire NBA season, which was initially going to be played without fans, was immediately canceled. As it turns out, a second member of that NBA team has now shown up positive. Heads of state have been infected. Actors, people all over. This virus has absolutely no respect for you or how famous you are or how wealthy you are. Everyone is fair game if you come into contact with it. Hand sanitizer, Clorox wipes, water, toilet paper. All are flying off the shelves or out of stock. And if you're able to get it, price gouging is happening. People are being asked to not purchase masks, which, if they become in short supply for medical professionals, would hamper those professionals' ability to perform their duties taking care of those who have become ill. As jobs enforce a work-from-home policy, all is well for those who have positions that will continue to receive their paychecks. But for freelancers, gigs getting canceled means there's no money to be made. Schools are closing and small businesses are feeling the squeeze. It is very serious. People are being advised to make sure they have enough water, medication, and any other necessities to survive a minimum of 14 days quarantine. So if you haven't done so yet, please go out and get what you need. Remember, and I can't emphasize this enough, take some extra time to wash your hands. Use a tissue if you sneeze, immediately discard it, cough into your elbows, and if you feel sick, call your doctor before heading to the hospital. Because, as you may have heard, testing kits are still not readily available in all states, and the tests are not for everyone. There have been strict guidelines enforced to determine who gets tested and who doesn't. At the moment, the United States has surpassed 2,000 confirmed cases of coronavirus. Cities are enforcing curfews beginning Monday, and in the hard-hit area of New Rochelle, Westchester County, about 270 members of the National Guard have been dispatched to help residents in the containment area, which is a circle with a 1-mile radius around the epicenter of New York's coronavirus outbreak. The National Guard is on the ground, and that number is expected to grow to 1,000 by next week in 6 different states which have been affected. Now, as I come to a close, to keep abreast of what is happening in your area, be sure to visit the CDC's website, www.coronavirus.gov, where you will find all the answers to your questions. This is Aigner saying bye for now. Stay safe, take care of yourself and your families, and check on your elderly neighbors. I'll see you next time.